Hi, psych people. So right now I want to take a second and go over one of my favorite chapters in your book. You guys know I'm a clinician, so this is like my favorite chapter. And it's on psychological disorders. Sometimes you'll hear them be referred to as psych disorders. So the first thing the chapter does is they define abnormality. And a lot of times when you ask somebody to define abnormality, it's a bunch of mumbo jumbo, right? But essentially what it boils down to is it's some type of like thing that causes stress in your life, right? And it's kind of atypical, and it hinders some type of functioning in at least one domain. So what do we mean when we talk about domains? Home environment, maybe your social environment, how you're interacting with your friends or family members or teachers or whatever, maybe work related, some type of domain, some area in your life. So there are many different perspectives on personality disorders, psychological disorders, and how they get started and things like that. And you guys can definitely muddle through those on your own. There's also a book. It's called the DSM. Actually, let me grab it for you guys. All right. So this is the DSM. This is the Diagnostic and Statistical Manual of Mental Disorders, and it's the 5th edition. So this is the latest edition. It is a big, huge book, and it has little tiny writing. And essentially, it has all of the mental disorders, and it goes into like all this detail on how to categorize them, and how prevalent they are, what other disorders we can compare them to. Like, so you have to know all of these if you want to be a therapist. And this book is great for a few different reasons. But it's also not so great because of other reasons, and we're going to talk about some of that. So the first thing I want to say is that it's great because it has it allows people to use an operational definition. What do I mean when I'm talking about operational definitions? So I talked about this a little bit in the beginning of the semester, but operational definitions are like, if I give my patient a form and it says, this is your diagnosis, and they bring that to the next clinic over, and they give that person that form out of this, with the diagnosis out of this book, that person is going to know pretty much exactly what's going on with them. Okay? If they bring this to Oklahoma, that doctor is going to know what's going on with them. If they bring this to Mexico, that doctor is going to know what's going on with them. So this is like widely renowned. Everybody kind of uses it as a basis of like diagnosing. It's really great for that reason, right? It helps for people to understand what's going on. It's also helpful because labels can be helpful. If you've ever been to the doctor and you're like, oh my goodness, I have this rash, I don't know what to do about it, right? Sometimes the doctors say, oh, don't worry about it, that's just such and such, here's some cream. Or, oh, that's such and such, and here's how we treat it, or here's how we don't treat it, or here's how we act around it, right? Whatever it is, you now have more information on what's going on with you. And that can be very, very helpful to clients and patients, right? Just knowing what's going on with them. Now, on the flip side of things, this book can be very controversial. This book has a lot of diagnoses where it's like, huh? What you mean, right? So one thing that happened was in grad school, when we were learning about this book, we had to go through this book, and each of us had a book. So we went through, and we had to diagnose ourselves with as many diagnoses that we could find that fit. And each of us left with about 20. So with that being said, some of this stuff can be generalized, and sometimes you'd be like, that don't need a diagnosis, right? Like right now there is a new diagnosis that just came in this edition, and it's a period disorder, right? When menstruation, and it's called premenstrual dysphoric disorder. And what this disorder is it's basically extreme symptoms of one's period, but I mean, it's supposed to be extreme, but it sounds pretty typical to me in my personal opinion, not professional, personal. But okay. There's also a gaming disorder in here. Now that disorder is not published as an actual disorder. Instead, it is a disorder. Like in the back, they have disorders that you'll consider like in the future because they're becoming more prevalent or whatever. But they have disorders that they're looking at, like maybe right. So these are for people who like to play video games or become very hyper focused and almost kind of obsessive over games, and it's hindering part of their life. And as a parent of teenage boys, I can tell you they might be onto something. I don't know, but it's controversial because I've definitely talked to gamers who are like, absolutely not, right? So there you go. Also, gender dysphoria is another one, and we'll get into gender dysphoria a little bit more into this video, but that's another very controversial diagnosis. Another way that this book can be harmful is through the stigma of mental health, right? We live in a society right now where mental health is starting to be a little bit more accepted in some cultures. Let me put that out there, because there are some cultures where you tell even like your parents, you say, hey, listen, I'm suffering from depression. Your parents are like, what you got to be depressed about? You got bills, right? Or it's like, so what, you want to meet with a therapist and tell everybody our business? No, right? So there's that, right? With other stigmas around mental health, there are things like people not listening to people who might suffer from mental health disorders because they feel that they are, I hate to use the word, crazy, right? So like, I'm going to post another video on an experiment that David Rosenhan did. And what he did was he checked himself into a mental health facility claiming to have heard voices. And they kept him there for, like, he said he heard it when he came in, and after that he said he didn't hear anything anymore. They kept him there. They gave him a long-standing diagnosis. Like, it was just like he wasn't being treated well. Like, he didn't get much interaction with anybody, even like the staff, right? So yeah, no one wants to be labeled in a way that they're going to be mistreated or feel like they're not being treated to the level that they should, right? So that's my little spiel on the DSM. Now, what I will say is that the diagnoses that are provided are broken up into categories. And so I'm going to go over those categories just so you guys have an idea as to what they are and what they mean. So one category is trauma and stress-related disorders. These include things like PTSD and acute stress disorder. These are this happens when you go through something that's trauma or stress-inducing and like a difficult situation, and then you end up having these symptoms, whether it's flashbacks, whether it's panic attacks, things like that. There's also anxiety disorders, and this is when you have excessive anxiety or fear. So, and it's irrational as well. So this might be like social phobia, social anxiety disorder, or generalized anxiety disorder. Okay? Some other ones are things like obsessive compulsive disorders, and these don't just include things like obsessive compulsive disorder. Like that's one of the most common things I would say that I hear is misused in terms of mental health diagnoses. Like, a lot of people say, oh my God, I'm so OCD. My house is so clean. That's not what that is necessarily, okay? So obsessive compulsive disorder is characterized by obsessions, which are your thoughts. And the way you alleviate that is through compulsions, which are actions or behavioral things that you do. So that might be, I have to keep my pen on this side. If I don't keep it on that side, I get really, really stressed out and my whole world kind of collapses. Or before I drink my water, I have to tap the bottle 3 times and then I can drink it, right? Or, oh, I have to clean my hands a lot. If I don't, I'll freak out about cleanliness. And so a lot of times you see people with those type of disorders with like scars on their hands from so much cleaning, or dry skin, cracked skin, stuff like that. Or even checking, like those people who leave the house and come back a bunch of times to make sure they check the stove, right? So that's that for those type of disorders. Oh, another type of disorder that we see that isn't necessarily like put out there in terms of obsessive compulsive disorders are things like excoriation disorder, which is when people will pick their skin. And this could be harmful because skin is there to protect us. And if we have a bunch of lesions and holes in our skin, it's no good, right? Also trichotillomania, which is a disorder where people will pull their hair, right? And they'll pull their hair and they'll pull it out. Sometimes they'll even like chew it or sometimes eat it. But essentially they're pulling out their hair as a way to alleviate some stress. And it doesn't necessarily have to be the hair on your head. Sometimes it's your eyebrows or your eyelashes or any other bodily type hair. So those are just a few of the obsessive compulsive disorders. Another type of disorder that we see is somatic disorder. These are when people have health issues as a direct result of stress. And I'm not talking like, oh, I got sick because I was so stressed out, it was finals. You know how that gets. No. I have a friend like that. Like, when she gets stressed, her voice just goes away, right? I'm talking about like very extreme examples. So like things like conversion disorder, where somebody might lose motor functioning or sensory functioning as a result of stress. So I had a surgery coming up and I got super stressed out and all of a sudden I couldn't smell anymore. Or I got into a car accident and even though there was nothing physically wrong with me, I couldn't move my left arm for an extended period of time. There's also factitious disorder, which is kind of similar to malingering, and this is when people make up some type of ailment that's going on with them. But the difference between that and malingering is with malingering, there is some type of a benefit at the end, okay? So whether it's money, whether it's attention, with factitious disorder, there's nothing. Another category, dissociative disorders. These are when you have a disruption in your conscious identity or your thoughts, or something like that. So I'm sure you guys have heard of dissociative identity disorder. This was also called multiple personality disorder, okay, back in the day. Now it's called DID, or dissociative identity disorder. And these are the things that a lot of like pop culture will highlight, like when we talk about United States of Tara or Glass or Sybil, shows like that, or in movies like that, where the person maybe deals with some type of trauma or stress by creating alters or alternative personalities within themselves, right? Another one is dissociative amnesia as well. Let me see. Mood disorders are another one. So mood disorders actually got kicked out from this book with this edition. Now they're broken up into categories of depressive disorders and bipolar disorders, bipolar and other related disorders. So let's talk about it. These disorders are characterized by either depression, mania, or varying moods. So you may say, okay, I get why depression isn't great, right? No one wants to be sad, right? And depression doesn't always look sad. But that's a conversation for a different time. So I get why why it would be a problem for somebody to be sad, but why would mania be a problem, right? Remember, these are extreme disorders and they affect some type of functioning, right? So mania would be a problem if, like, what do we mean mania? Extreme happiness, okay? That'd be a problem because what people do when they are manic is they go out and they might spend all their money and not have any money for food, for rent, for anything, okay? They might feel like they can fly and maybe jump off of something, right? Because mania is like, I am on top of the world. I'm doing great. Things are going great. Another thing about people with mania is They don't really sleep. Might sleep a few hours a night, maybe like 2, maybe, but they're not really sleeping. And that's part of the issue with the bipolar, is that you're having these varying, and other bipolar-like disorders, you're having these varying symptoms where you're manic and then you're depressed. It used to be called manic depression, by the way. But so that's another one that's widely misused. Like, oh my goodness, it's so bipolar. Like, no, it doesn't. No, it's very cyclical, and the timing is very important to note of when these changes occur. Let me see what else. Psychotic disorders or other schizophrenia spectrum disorders. These are when people have abnormalities in their perception. So like delusions, hallucinations, disorganized thinking, motor behavior, and negative symptoms. Now, by negative symptoms, I mean like a lack of something. So whether it's like expression or whether it's a lack of like initiating events or whatever. And so we know like we have schizoaffective disorder, schizophrenia, like things like that. So personality disorders are characterized by a pattern of inner experiences that are inflexible and extreme. So we have things like paranoid personality disorder, borderline personality disorder, which is basically you struggle socially. But it's like not just like, oh, I'm struggling a little bit socially, like it's very extreme. Antisocial personality disorder, that's another one. So you guys have heard of this, probably not by that name. A lot of times people say, oh, I'm antisocial, I don't like talking to people. It's not how it works, right? So antisocial in psychology, it means that you're going against the grain so hard where you violate people's rights. Okay, so and you don't really how can I put this? You don't really feel empathy as much. You know what I mean? Or your empathy, the way you perceive things are a little different. So antisocial personality disorder used to be called, if you ever heard of terms like psychotic, psychopathy, like a psychopath, or sociopathy, like a sociopath. You guys ever heard of those terms? Antisocial personality disorder. So these are people who aren't really feeling empathy like that, don't really have much remorse, things of that nature. There are childhood disorders. These are disorders that are characterized by the onset being during childhood. So we have things like ADHD. That is attention deficit hyperactive disorder. And that's characterized by like not being able, either you are inattentive or hyperactive. It's kind of very in the label. Substance and addictive disorders. So those are characterized by the continued use of substances despite the substances having some issues in your life and relating to problems. Like, so it's like an addiction, obviously, right? So you can't really stop. There's also eating disorders. We spoke about a few of those in this class already, anorexia and bulimia, right? But there's also things like pica, right? Where people are eating things that are not supposed to be eaten. So like, might sit there and eat this pen, right? And just like eat it. Or binge eating disorder, when people are overeating, right? Sexual disorders are another category. So this is when there are sexual response issues or issues with sexual pleasure. So like we have like erectile dysfunction, right? Which is when men struggle with performing sexually. Or penetration disorder, which is when it's very painful, right, to have sex or to be penetrated. Like, and I'm not just talking about ouch, that hurt, like it's extreme. Also, there are neurocognitive disorders, and these are disorders which the onset is usually definitely during the developmental period. So when they're in utero, when they're when you're pregnant with the baby, and they manifest early in life. So you see them during like the early years, and they cause significant life impairments such as like intellectual disabilities or communication disorders or even autism spectrum disorders. Now, There are also sleep-wake disorders. I'm getting close, y'all. I know it's a lot. Sleep-wake disorders. So these are things like narcolepsy and insomnia. We spoke about those a little bit during chapter 4. Gender dysphoria. This is a distress that accompanies incongruence between one's assigned gender and their expressed gender. So, like, it's not necessarily that you are experiencing a difference in your gender, right? It's the distress associated with that experience. So there's also disruptive impulse control and conduct disorders. And these are characterized by behavioral issues that violate the rights of others. So like intermittent explosive disorders or pyromania, right? Which is like when you're setting fires and things like that. Kleptomania, when you're stealing, right? But remember, well, don't remember because you never knew. But pyromania and kleptomania, you don't get any, there's no gain from them. So like you're not setting your store on fire for insurance purposes. You're not setting your boyfriend's bed on fire because he cheated on you, right? You're literally setting fires because they have like a and both of them have this tension and release thing that goes on with them. Like you feel tension when you're getting all so excited about it when it's about to happen and you're thinking about it, and then once it happens it's almost like, oh, it feels so good, right? So pyromania and kleptomania. There's also and kleptomania is when you steal. I don't know if I mentioned that, but ODD or obsessive oppositional defiant disorder. That is characterized by essentially oppositional and defiant behavior. So like you're blaming others, you're not taking responsibility, you're lying, you are violating rules, authority is talking to you and you're like, get out of here, right? That type of thing. There's also paraphilic disorders, and paraphilic disorders are, they're more extreme than just sexual quirks, but they're sexual disorders almost. So like, for instance, frauderistic disorder is when you would like, someone would rub up against somebody in a sexual way and they would get very, very excited about that sexually. So like, this might be people like you're on the T, it's crowded, and maybe somebody is rubbing up against you, but they're having a jolly old time and you're not even aware of it, okay? Other things are like exhibitionistic disorder. That is when somebody exposes themselves. And they, for lack of a better word, get off on it, right? Voyeuristic disorder is like the opposite. It's when somebody watches other people. The other people are unknowing and unwilling participants. Okay, so that becomes a problem. And then there's another one, pedophilic disorder, which is when somebody, an adult, is interested in children or, you know, much younger. So that breaks down all of the major mental disorders that are in this book. There are some other disorders, but they're kind of general and just don't really fit anywhere, like medical disorder, that type of stuff. But I hope you find this video helpful. I know it was a lot of information. It's just basic information, but I know it was a lot. But if you guys have any questions, as always, reach out, please, please, please. All right.